Today, I'm really excited to talk to Monika. So Monika, I first met her in Vienna, or at least this is like the memory that I have of her. And we were in this like old historical building. And we were on the eve of her publishing the results actually that we are going to be talking about today. And I think everybody was so impressed because for the first time, we were actually talking about parents with intellectual disabilities, but on a population-based, length. So we were talking about a sample that was much larger than any of us at that time had done. So we were quite excited to meet with Monika and to talk with her and to have her come and do research in our field. So Monika, it's so great to see you today, and thank you for being here with us to talk about research.
Thank you, Marjorie. I actually remember that conference very well. It was my first IACID conference, and what I remember clearly, because I'd written that paper with Susan Parish, and everyone we had cited was actually sitting in that room. And that was one of the first times I was like, oh my God, this is fantastic to be able to talk to all the people that we had cited, we had read about. So it was a great conference. And I remember meeting you there as well. So
yeah. It was one of my first conference on a wheelchair. So it was quite a challenge for me to just like show up and be there in Austria. So I'm going to start by just, trying to get to know you in terms of how you got in the field. Because we all have a story of a mom that we met, and that's how we started. We're all clinicians at first, usually. But in your case, I think it's a bit different, or maybe I'm wrong. So tell us how you started in the field.
So the field is, I guess I'm thinking, is it the field of disability and health research or the field of pregnancy and parenting? So I'm going to start with the field of disability and health research, which is really how it was my entree into this. And I was straight out of my, I was actually an immigrant, a foreign student at that time. I was doing my dissertation, and I was doing my PhD, and I wasn't quite sure about my dissertation topic. When my advisor got a grant looking at examining employment opportunities for disabled people in the United States, and it was a comparison between the US and Sweden. And as I started doing the literature review, I very quickly realized that this was a population, so we're talking early 90s, mid 90s, a population that really was missing in the pedagogy, in any of the classes I'd taken, was missing in social, not social media, but in mass media, in representation. And it was really a population that no one discussed. And so that really got me intrigued. And then as I started doing the research, which was using at that time a population-based, it was the Survey of Income and Program Participation, I really quickly realized that this is a population that faced incredible disparities. So this was sort of this disconnect between the incredible disparities that people with disabilities faced, both in terms of employment and socioeconomics, but also the lack of recognition, understanding, examination of these disparities. So that sort of got me into the field of disability and health research. And if I can fast forward to sort of pregnancy and parenting, years later, I was, I was writing this paper on physical abuse and women with disabilities during pregnancy, using a population-based data set as well. And my focus was more on the physical abuse than the side of, than pregnancy. But again, looking at the literature, I very quickly realized while there was an emerging body of literature of studies on violence and violence victimization among disabled people, there was nothing on pregnancy. And it was shocking, and yet not shocking, because as soon as you unpeel the first layer, you realize this was a manifestation of our eugenic history. This is a manifestation of social economic policies that prevent people with disabilities from becoming pregnant. And Marjorie, if I may, I want to talk, you referred to as this one person you met as a clinician. So I'm not a clinician, I'm a researcher. And I've been studying and working on pregnancy and parenting for a while. And until quite recently, I have to say, I did not realize, the depth, I didn't realize quite why I was so involved and taken with this topic until I've been thinking about my mother. And my mother had this skin pigmentation disease. I grew up in India, and she had the skin pigmentation disease, which realized, she's a brown woman, and she slowly lost her skin color. And this was when I was very young. And and this is a genetic disease, and as a result of which she was socially ostracized. And this is something we lived with, and it was both embarrassing for me, but also I was very protective of her, and I was very, embarrassed for her also. And just, so it was, and I think I didn't realize that I was a child of a disabled parent, because we all have, even for someone like me with the kind of lens and with the work that I've been doing, it's quite a recent recognition that that my mother had a disability, and I've really grown up with that. So.
Wow, that's an incredible story, actually, Monika. I really, I love that, and I love that you were able to sort of reflect back and sort of find that, that might have been a contributing factor, certainly, in terms of making and doing research that is very socially justice driven. I know that when I read your papers, I often sort of feel like, there's a call to action, and there's, an urgency to do something in terms of policies or systems, organization. And I really like, I think that's one of the best part about your papers and your research, for sure. And so that would be like a great segue to start with the first paper that you submitted for today, which is basically pregnancy outcomes for women with IDD. It was published in 2015, so 1 year after that conference in Vienna. Do you want to tell us a little bit about sort of that study and the results that came about?
Sure. So this was a study on, we used a state data set. It's a longitudinal link data set, which links hospital discharge data as well as with birth certificate data. But really the background of this is by then I had already, I was in the midst of a national study on systematically examining the pregnancy outcomes and the barriers to perinatal care for women with physical disabilities. And as I was working on this, I met a really close colleague, Susan Parish, and we were, thinking of a study on women with intellectual and developmental disabilities. And this is of critical importance because if there is one disabled population that has really been impacted by eugenics, and I'm thinking Long-Bellil, it is women with intellectual and developmental disabilities. So it's really it was something that we really wanted to do. And what we very quickly again realized that there was a complete dearth of studies, particularly studies that were grounded in data, and so we wanted to really understand what are the experiences on one hand, and what are the outcomes in terms of pregnancy complications, in terms of maternal and birth outcomes, in terms of their prenatal care and their postpartum care. But the issue with that is and Marjorie, this is that very few surveys actually identify disability, particularly IDD status. And so the question is, how do you get at outcomes? So we were writing this grant to NIH on pregnancy experiences and outcomes of women with intellectual and developmental disabilities when we decided to use a imperfect backdoor approach to identifying people with IDD. And that was using ICD, at that time, ICD-9 codes. And we all know the limitations of this, and I'm absolutely the first to acknowledge it, but it was one of those imperfect solutions because there was no other. And at that time, the surveys, which is the National Survey of Family Growth, and again, this is US based, I realize, or the pregnancy risk assessment monitoring system did not include disability identifiers, particularly identifies, for women with, to identify people with IDD. So this was one backdoor approach, and really what we, what we came up with and what we published were really astounding and unfortunate disparities. Disparities, and there's been a series of papers since then by myself, but also my other colleagues, and is on that women with intellectual and developmental disabilities have higher rates of ED visits, emergency department visits, hospitalizations during their pregnancy, as well as at postpartum. What we also found that women with IDD had were more likely to have adverse birth outcomes. The question, of course, is, which is the issue with a paper like this, is that it gets at the very high level, superficial, like, yes, here are the outcomes. What it doesn't get at is why.
Mm-hmm. Yeah, but, since that paper, there's been several ones, and like you said, from yourself, from some of your colleagues, that really showcase this disparity, and time, like all those studies really shows this disparities. It also shows sort of the importance of intersectionality in terms of different identities, and how that puts, women potentially more at risk because they are overrepresented in those samples. Do you want to talk a little bit about that in terms of, the fact that they're more likely to be Black and Hispanic, for example, in those samples that you found?
Absolutely. And I think that if you're thinking, and maybe I'm jumping ahead a little bit, but really our, the research that we need to conduct as a community and as a global community. So let me just speak about maybe the US and North America, is we really need to focus on these populations that have been largely underrepresented in this research, which is, what are the disparities? How do Black and brown women with disabilities and with different types of disabilities navigate the healthcare system? What are the systemic barriers that they face? What are the pejorative attitudes, if any, that they face? And what are the outcomes of this? So we really need to do a deep dive into this. And the excuse of small sample size or difficult to reach is really something that we need to leave at the door. And I think, and that's, again, I'm going with, I'm going to speak of the US because that's the country that I've really been focusing on in my research. But globally, I think we really have to, and then again, Marjorie, and I asked if this is a discussion we have in the parenting circle, for example, is where are studies that have been focused on people in the global South? And this is something that we really need to find ways to highlight. So it is there are several, our understanding in the literature has largely been on women and people in high income countries, and also usually very white samples. And yet with all of that, we found disparities that are, incredible and wide and again, disappointing, right? But it is literally, but I feel like we haven't scratched the surface. And what we really need to do is widen and also deepen our research.
Yeah, definitely. I think, like you said, we've had that conversation many times, and it's really about finding the solutions and being creative to get to that and to get that information. Certainly. So one of the studies also that you brought forward for this podcast is the perinatal health framework, which I thought was interesting because you're bringing sort of a lens or a framework to be able to observe and understand what is going on in women with physical disability in this case, but it could be applied with all women with disabilities and all women really, in terms of like pregnancy care and understanding postpartum follow-ups. So do you want to talk to us a little bit about that?
Sure. So this was actually, I'm going to take this back a few years. And when we first wrote this grant, on pregnancy among women with physical disabilities, which was before our studies on women with intellectual and developmental disabilities, this was a group of colleagues, including Linda Long-Bellil, Dr. Suzanne Smeltzer, and Dr. Lisa Iezzoni. So it's really the four of us who were, had conceived the study. But as we were going into this, and again, on one hand, there was really very few studies, empirical studies on pregnancy outcomes of women with any disability. But what we also realized is there was no framework. There was no kind of attempt at sort of understanding, how we, or frame the issues around pregnancy for people with disabilities. So we decided to, embark on this, as you're writing this grant, but also kind of, using chalkboards and whiteboards and trying to kind of, work on this framework. And it was really exciting actually at that time. And I, so what we wanted to do, what we actually, in order to develop this framework, we really built on the work, for example, of Don Mitra and colleagues, who had actually first kind of, when they talk about, when they wrote about perinatal care, perinatal health, they use a life force perspective. And that is particularly important to people with disabilities, particularly important to women with disabilities, right? Because pregnancy, the interactions with the healthcare system, for example, don't begin at conception, don't begin at the first prenatal care appointment, right? The second piece that we also is Michael Liu and colleagues that had looked at, what they call the cumulative burden, and which is really about how, again, it builds on that life force perspective, but their work focused again on Black and brown women and women of color, and talked about how sort of this a lifetime of racism, has, so it really is carried, the impacts of that are carried to pregnancy and perinatal health. So the same thing, I think, for women with disabilities, what we felt like it was, again, it didn't begin, the issues didn't begin during the first prenatal care appointment or at conception or even at a preconception appointment, but it is the systemic ableism, that is, that sort of creates this cumulative burden. So by the time a person is engaging during their first prenatal care appointment, they already have this cumulative burden that they're carrying, and that could could have several impacts, for example, in their lack of desire to engage with the clinicians, or in terms of their heightened awareness of the ableism that they're facing during their prenatal care appointments and at childbirth. We also wanted to, in this framework, take into account, obviously, the environmental factors. We wanted to place pregnancy and perinatal health, both in terms of the life force perspective, but also in terms of the built environment. We wanted to place it in terms of the policy and the legal environment and the cultural, and as well as, in this case, the social environment and the social attitudes towards pregnancy and towards parenting for disabled people.
Yeah, I like your framework, and of course, one of the shows here was interviewing Maurice Feldman. So we talked about his model in terms of understanding parenting. What I like is that there's, definitely parallel with the framework that you're talking about, but there's an extra layer of a lens, I think, in your framework, where you really look at sort of the social and the perspective that society might have, and you bring in sort of that notion of ableism that is not so obvious in the hypothetical model from Feldman. And so that to me is something definitely that we need to talk about a little bit more, how ableist and preconceptions really have an impact on everything, which then sort of, it's a disparity, but not just like one time. It's a disparity that comes in and comes back at different moments of their lives. And it's just, talks about accumulated risk. And I think that that's one of the greatest contribution of your research for sure. So the third one that you brought forward is basically talking about the pregnancy of women with physical disability and looking at the unmet needs, but also focusing on recommendations. And so because, this podcast is for childcare workers and clinicians, I was wondering if you could sort of talk about those recommendations that we should all be aware of and, put in practice.
Absolutely. So that paper, if I remember correctly, we interviewed about 25 women with physical disabilities, and really to understand, what were the barriers to care. And we also, at the end of the interview, asked them if they had recommendations to other disabled women, and as well as to clinicians. And I just want to tell you, we also later in the grant interviewed clinicians about their, and these were clinicians who were relative experts in providing perinatal care to physically disabled women, and about sort of a similar, kind of a mirror to what we asked disabled women. What were their barriers to care? What were their recommendations to other clinicians? And what we really found is that it was actually a mirror image, what disabled women discussed and spoke of in terms of their barriers to care, and their recommendations was very similar to clinicians. So, the barrier, the interviews were both shocking, surprising, and then again, not so shocking and not surprising in terms of the pejorative attitudes that they faced, in terms of the access barriers that they faced, in terms of the lack of information, the lack of information, both in terms of books, or at that time any written material, as well as from their clinicians. So really, disabled women, what they wanted was, one is training. And both in terms of, for clinicians, is an understanding of the needs of disabled women, and they said, treat us like anybody else, and sort of not focus on their disability. And they, so, and really comes to, the need for training during their medical education, during their training, for clinicians to be exposed and understand the needs of disabled people. The second, what disabled women talked about was, their need for information. What they recommended was, give us information about the interaction about our disability and our and pregnancy. Because at that time, I mean, this was, these interviews were done, I think about maybe 7 years ago, and social media hadn't exploded the way it has right now, and so so women really were frustrated by the lack of information, and so they needed more information in order to navigate. And not everybody lives in a metropolitan area, right? And so particularly women, for example, in rural communities and communities that were, more isolated, where they didn't have, didn't have a disabled or peers that they could reach out to. The other was just the accessibility of offices. I mean, this was, now we're 31 years past the ADA and the Americans with Disabilities Act. We're still seeing it. It's not like things have changed in the last 5-7 years. For example, women who had congenital disabilities spoke about how they had never been weighed in their entire lives. They had never been weighed. And many of these women, for example, a number of women that we interviewed were women with dwarfism. They were little people. And they had talked about, for example, they talked about the lack of accessibility. For example, I remember one woman talked about how she would, so she would take a step stool. So she had a cesarean, and she would take a step stool from her bed and kind of take that stool after having the day after having a cesarean, take it from her, to climb out of the bed, to get out of the bed, and then carry it to the bathroom so that she could wash herself. A simple thing like a step stool. So the lack of accessibility, and the pejorative attitudes, the lack of information, and also women talked about was, ask us. We are the experts in our body. We live with this. Don't make assumptions. If you have a question, ask us, because we know what's the best way to transfer. We know what, and so I think this was something that was really that disabled women felt very strongly about. And I think finally also just care coordination. Reach out to my, the other clinicians that that were part of their care network, and ask about this, instead of making, again, assumptions, or actually not even taking the time to do the research. So there were several really important recommendations that came out of this.
Yeah. It's funny because not funny, not the right word. It was interesting because as you were talking about the results and sort of like the moms and what they brought forward, as you know, 10 years ago, I became paraplegic. So I was born in an able-bodied, and then ended up sort of disabled. And the incredible amount of places that I can go to because I'm on wheels now, it's just incredible. And that starts with some hospitals, some like healthcare clinics. And every time I'm baffled, because I'm sort of like, wow, like we're in 2022. You talked about the ADA in the States. In Canada, we have similar sort of policies. We are countries that have, ratified or at least sort of been part of the Convention on the Rights of People with Disabilities. We know about sort of Article 23, about the right to family, about the right to anything, like to be able to do what anybody else does. That's pretty much what the convention, is stating. And yet we have all of those, little things that nag us, because it's sort of like every time I felt like, okay, well, I'm not welcome here. Obviously, if there are stairs, right? And so if I'm not welcome, then it means that a child who's in a wheelchair is not welcome. It means that a mom with, I don't know, even like a stroller, might have a difficulty getting in. And these are healthcare facilities. So I think this is also a very important seminal paper. And I hope that, we continue to work towards using those recommendations and making sure that they're applied. So that's my wish as both a researcher and a person with lived experience now. That will lead us to sort of what's next. Where should we go from here? You alluded a little bit of that earlier, but I would let you sort of talk about what you think would be the next step in terms of research or practice or policy, because I think you touched all of those areas.
So what is next? There's a lot. There's a lot that we as researchers, as practitioners, as policymakers that we need to do. I'm going to speak with my researcher hat on, and I think, as I mentioned earlier, I think in terms of really what we need to do is investigate, understand perinatal health for people with other marginalized identities. So we really look at the intersection, for example, of disabled people and trans, disabled people and who have LGBTQI identities. We need to understand what are the Black and brown women with intellectual and developmental disabilities. So I think we really, on one hand, need to delve deeper and really, bring out the needs and the experiences of disabled people with other marginalized identities. Taking this globally, as I mentioned before, really on the global south. I mean, it is, a call to action is an understatement, because obviously the needs of disabled people, and I'm just going to use the example of India, of women who are living in rural India who have, for example, physical disabilities, are very, very different. And how much of that do we know? I think that, so there's one body of work that is really looking at both global south, but also women with other marginalized identities. The other, which is what we're trying to do both with our, I think this, I co-lead two centers. One is the National Research Center for Parents with Disabilities, as well as something that we've just recently launched, which is the National Center for Disability and Pregnancy Research. And Marjorie, you're involved with both. And so what we really are trying to is get at that next step, is trying to build a body of evidence-based interventions, evidence-based practices, so that we can support disabled people during their pregnancy and during their parenting. Because on one hand, we know that there are disparities, but the question is, what do we do with it? What do we do with this, and how can we change both? How can we support people with disabilities during their pregnancy? How can we, but also thinking about how can we support policies that, how can we, what research can we do that can support policies? So there's, again, there's plenty for us to do. And I really am very appreciative of the collective body of researchers that, and both, for example, datasets SERG has brought together that, so that we can do this collectively and we can inform each other and we can work together.
Yes, I'm really happy that you talked about both the centers, because I think that's really important, and that's definitely a place where we can sort of all come together and collaborate and partner up to make a difference. And I think that that's, what drives us all. So I'm happy you mentioned that. You also sort of have this beautiful website that now has information on pregnancy that's just out, I think.
Yes,
so
as of last week, I think.
Yeah. So do you want to just briefly talk to us about that one? Because I think that's important.
Okay, so they're both, the National Research Center for Parents with Disabilities, as well as the National Center for Disability and Pregnancy Research. They're both funded through NIDLR, which is the National Institute of Disability, Independent Living and Rehabilitation Research. And again, this is funded, even though they're both based in the United States. What we're really trying to do is, and hopefully over time, is take the work globally and be more inclusive. And so this time, for example, Marjorie, you're involved, and Hillary is involved, and Maurice Feldman is involved. And so that's been, we're trying to have a more, get out of the United States. For the Parenting Center, for example, we've actually started this consortium of researchers who are working in the area of to support parents with disabilities, and that's, I think, going to be, I'm very excited about that, because this is it's a little bit, it's similar to what I'm trying to emulate is the SERG, right? But really expand our focus from parents with intellectual and developmental disabilities to parents with all disabilities. disabilities. But going back to the website, yes, we have two websites, and the one with the Pregnancy Center, which was just launched 2 weeks ago or maybe last week. And what we're really trying to do with these websites is to inform parents or prospective parents, inform other stakeholders, including child welfare professionals, including advocates, including community organizations that are fighting for rights, and really trying to, and as well as researchers and multiple stakeholders. And maybe we're trying to do too much, I don't know, but we have to start somewhere and disseminate the research that's ongoing. From the research, and we have researchers again, involved in both centers from all over. And so what we want to do is really disseminate. It's sort of this portal to disseminate our information. So, I welcome feedback, and we're very excited about it. And I think this is absolutely the first website that I know of, which is really focused on pregnancy and disabled women.
Yeah, right after it launched, I shared it on my social media accounts, and I have to say that I got so much traffic on that post and comments. People were just amazed, and when I say people, it's women who have a disability, and it's women who are moms. And they were like, oh my God, thank God. Like now maybe there's, a place where we could go or direct sort of our OBGYNs or our healthcare professionals towards. So I think it's potentially, it definitely has potential for changing the game. So that's really exciting.
And as part of that, we want to do, trainings and webinars, again, to again, for different populations, for women with IDD or women with different disabilities, but also, for example, maternal and child healthcare professionals, to clinicians, to child welfare professionals. So we're really over the years is both our research, but also thinking about trainings and other types of information to different stakeholders.
That's awesome. So it leads me to the last and final question. If you could speak to childcare workers, what is the thing that you would like to tell them?
So it's a great question. And the one I'm going to start with, I don't have a pithy one word, one sentence, but I'm going to start with that disabled people, disabled women live in fear of child welfare professionals. Throughout the work that I've done, for all the interviews that I've done, whether it's women who are deaf and hard of hearing, women who have intellectual and developmental disabilities, women with physical disabilities, they live in fear of their children being taken away from them. They feel collectively that they have to be better parents. They cannot afford to have a hysterical child in a mall, a grocery store, which being the parent of 2 kids, I have experienced myself, but they cannot afford to have that happen in case a person down the aisle calls the department of, it calls a child welfare professional. And so this is really, really important for child welfare professionals to understand. And also, at least in the United States, that they need to be aware that that they cannot use disability as the grounds to terminate parental rights. And the third, I would say, is find ways to support parents with disabilities that you're involved with. Don't use disability to discriminate, but use disability to find ways to accommodate, to support, and really to bring the child and the parent together. So I think that we really collectively, again, and this is something that I'm working with Liz Lightfoot on developing trainings, and this is through our National Research Center for Parents with Disabilities, is trainings for child welfare professionals, that and trainings on disability. trainings on, who are people with disabilities and how do you work with people with disabilities, and really about disability rights and disability justice.
Yeah, I think that's, going back to each of us being creative in our roles. We each have a role to play in all of this. Certainly as researchers, we need to be creative in finding and making sure that there's representation, of all women, of all parents, because it's not just
All people, yeah.
all people. And workers that are in the trenches. It's about sort of being creative in finding resources or ways to adapt and support. So I think that's a great way to sort of end our conversation. I just wanted to thank you so much for taking the time today. And for everybody, just to know that everything that we talked about today will be in the show notes, and you'll have links to all those wonderful websites that we were talking about. So thank you so much, Monika.
Thank you, Marjorie. This was a pleasure.
Thank you.